My name is Dr. Branche-James. I'm an OBGYN at Advantia OBGYN of Shady Grove in Rockville, Maryland. And I'm going to talk with you today about cervical cancer. So oftentimes we get the question, is cervical cancer hereditary? And there's definitely a genetic predisposition to developing cervical cancer. So if your mother or your sister or your aunt has had cervical cancer, you may have an increased risk. There are also other important risk factors such as smoking or having a weakened immune system. Ultimately, the most important risk factor for developing cervical cancer is the HPV virus. And this is a very common sexually transmitted disease. It often has no symptoms at all. And most of the time, patients can clear this virus on their own. Their body is able to clear it on their own. However, sometimes it becomes a chronic infection. When it becomes a chronic infection, it does increase your risk of developing cervical cancer. And this is why pap smears and coming to see your OBGYN annually is extremely important. And staying up to date with your pap smears is also really important because that is what we're using to screen for abnormal cells on your cervix, which could be an indication of cancer or precancer. Cervical cancer is one of the only cancers that we can screen for and hopefully prevent. So it's really important to make sure that you're staying up to date with your OBGYN. And if you're looking for a new OBGYN, I am accepting new patients. So come and see me.